Part 2 of Book 3, Post-Discharge. A follow-up appointment will be arranged before you are discharged. For the first 6 weeks, follow-up visits may be twice weekly. This may be changed to once per week for about a month, then once every 2 weeks for another 6 months. This is a general guideline and may change based on how you're doing. You can expect to have blood drawn regularly during these follow-up visits. You will be closely monitored until day plus 100. Complications related to stem cell transplant tend to appear during that time. Day plus 100 is a special milestone after your transplant because you are considered fully engrafted. Follow the instructions during follow-up. Your transplant cannot be successful without your cooperation. Immunosuppression, drug level monitoring. In order to ensure the immunosuppression medication dose is therapeutic, the level of the drug in your bloodstream must be monitored. Typically, this is done 1 to 2 times a week. It is critical that the level is measured accurately so the transplant doctor can prescribe the correct dose. If the dose is too low, the risk for graft versus host disease increases substantially. If the dose is too high, the risk of severe side effects increases. The level when the drug is at its lowest point in your body, which is right before the next dose is due. Here is how you can help to ensure your level is accurate. Get into a routine of taking the medication at the same time every day. On the days when the level is being drawn, do not take the morning medication dose, but bring it with you to your clinic appointment and take it as soon as the level is drawn. Immunosuppressants should never be taken with grapefruit juice, and consumption of potassium-rich foods such as bananas, prunes, raisins, and orange juice. Talk to your transplant doctor before taking any vitamins or herbal supplements while taking your immunosuppressants. What about daily self-assessments? Take the time every day to complete a head-to-toe self-assessment. The best time to do this is in the shower. Look carefully at your skin. Take some deep breaths, press on your abdomen, and inspect the bottom of your feet. Ask yourself, how do I feel today? Is anything unusual or different? Have things gotten better? Are they worse? Or are they the same? What can I do today to improve the way that I feel? You know yourself better than anyone else. Catching complications early makes treating them more successful. Do not let your guard down. Infection prevention. You are still at risk for infections even after engraftment occurs. Your immune system is working, but it is suppressed by medications and is very fragile. You have 3 infectious enemies after transplant. Bacterial, such as pneumonia, and can occur in your PICC line. Viral, such as shingles or cytomegalovirus. And fungal, such as aspergillus or candida. You will be prescribed a medication to prevent each type of infection for the first 100 days after your stem cell transplant. Make sure that you understand your prescriptions and when you need to take each medicine. Some infection prevention tips to consider. Washing your hands and having others wash theirs is absolutely the best way to prevent infection. Avoid people who are coughing, sneezing, or show any other signs of a cold or flu. Take your temperature every day after discharge. and call your doctor immediately if your temperature goes above 38 degrees Celsius. Do not ignore colds or flu. Bath or shower daily and wear clean clothes. If your skin is dry, use a mild lotion or baby oil. Do not share cups, glasses, utensils, etc. with others. If you have a PICC line, keep the dressing clean and dry. Cover it when showering. Do not place it under water. Report any dressings that are loose, wet or open so that it can be replaced immediately. Brush your teeth with a soft toothbrush after every meal and at bedtime, and floss daily. Make sure that you take your medications to prevent infection as prescribed. Now let's look at getting back to feeling well. Patients may be surprised that they feel worse the first few days after they are home than they did the last few days in the hospital. It is easy to underestimate how much rest you get while in your hospital, surrounded by caregivers, with the restroom 4 feet from your bed. Your home may have stairs to climb. The kitchen may be far away from the bedroom, and you may need to travel long distances by car to get to your medical appointments. And all of these factors quickly add up and can leave you feeling extremely fatigued, great one day and horrible the next, mood swings, anxiety, loss of appetite, and a lack of interest in relationships and or previously enjoyed activities. As your body continues to heal, your energy level and your mood should improve. In the meantime, speak with your nurse, doctor, or social worker about your feelings and your concerns. Medications or alternative therapies may be recommended. Your transplant team wants you to recover as quickly as possible so you can get back to normal life again. So some activity recommendations. The following list provides details about some things that you should avoid during the first 3 months after your transplant. Be patient with yourself. You have been through a difficult experience and your body needs time to recover. Your doctor will let you know when it is safe to resume these activities. If you have specific concerns about any activity, please feel free to discuss them with your doctor. Take it easy. Allow yourself time to rest and get enough sleep. Daily light exercises such as walking will dramatically improve the feelings of fatigue. Start back to work only with your doctor's approval. Returning to work is based on your endurance and the type of work that you do. Avoid large crowds, such as grocery stores, churches, and movie theaters, until your doctor tells you it is safe. Avoid people with cold or flu symptoms. Remember, limit your exposure to the sun. Your skin may still be extra sensitive to the sun from the chemotherapy. Also, sun exposure immediately after transplant can trigger graft versus host disease. Wear a sunscreen with a minimum SPF factor of 30. Always wear a hat, long sleeves, pants, and sunglasses. Do not go to the dentist unless approved by your transplant doctor. Dental procedures at this time could cause an infection. If you have to use a public restroom, wash your hands thoroughly using a paper towel as the final step in turning off the tap. Avoid swimming in pools, spas, jacuzzis, lakes, or ocean water unless approved by your transplant doctor. Your immune system is not strong enough after transplant to avoid infection from these sources. Do not smoke or expose yourself to cigarette, pipe, or marijuana smoke. If family members smoke, ask that they do so outdoors and away from you. Lung health is very important after transplant. Do avoid contact with pesticides, solvents, fertilizers, chicken coops, caves, construction sites, and other areas where soil is being removed. Avoid gardening until your doctor tells you that it is safe to do so. Avoid zoos, parks, animal areas, and areas heavily populated with birds. All of these things may have chemical irritants, fungus, and bacteria that your immune system, which is new, is not ready to fight. If you own pets, remember, have someone else pick up after them. If you own a reptile, fish, or birds, avoid contact with them and ask that others wash their hands thoroughly and immediately after touching them. Why? Some pets have bacteria that your new immune system is not yet ready to fight. Now let's look at post-discharge diet. Many patients have difficulty eating well after their transplant. The taste of food will be altered due to the conditioning therapy. Fortunately, this will improve over time and eventually return to normal. It is recommended that you follow the low microbial diet for 100 days after transplant. It is very important to drink lots of fluids and stay hydrated unless otherwise instructed by your nurse, doctor, or dietitian. Try to eat a variety of nutritious foods and snacks. Emotional and intimacy concerns. You may find yourself feeling sad or depressed in the months following a blood and marrow transplant. There are many potential causes: medication, fatigue, or anxiety about the future. These feelings are normal. Be sure to discuss them with your caregiver at home as well as with your doctor. Many patients find it comforting to speak with someone who has been through a transplant, so let your nurse know if you are interested. Rely on family and friends for support and assistance. If they offer to help you, let them. Intimacy can be difficult for patients after a transplant. Your body has been through a lot of stress, and your physical appearance has also changed. You may have lingering physical effects from the stem cell transplant that directly affect your sexual health. The good news is that it's okay to have sex. Talk to your partner about your feelings and go at your own pace. And also feel free to discuss any concerns with your doctor, nurse practitioner, clinic nurse, or coordinator, or whoever you feel most comfortable with. If your platelets are low, ask your doctor before having sexual intercourse. Transplant conditioning regimens may result in infertility for patients, male or female. However, there is always a possibility of pregnancy, even after a transplant, so please consult your doctor about options for contraception. What about immunizations? Immunizations may be dangerous to your weakened immune system right after your transplant. You will need to repeat all your childhood immunizations 1 year after the transplant. But we will arrange this during a clinic visit. A flu shot is highly recommended for your family members and close contacts. Your transplant doctor may recommend a flu shot for you 6 months after the transplant. Avoid contact with infants or children who have been recently immunized for measles, mumps, rubella, polio, smallpox, chickenpox, or yellow fever. These are live virus immunizations. Now, when to call the doctor or nurse? If you are feeling unwell, it is always safest to call right away. Tell them that you are a bone marrow transplant patient and give them the name of your nurse practitioner or doctor so they can contact the correct person. These are examples of reasons to call. Fever. a temperature of 38 degrees Celsius orally or higher, chills and sweating, cough, a rash, unable to eat or drink fluids, redness or pain at the PICC or IV site, vomiting, mouth sores, diarrhea or constipation, bleeding, pain, painful or frequent urination or unable to urinate, a yellow jaundiced skin, or generally feeling unwell or that something is wrong. A fever or infection after your transplant is an emergency. You must call right away if you have a fever at home. A fever can be fatal if you wait to call. Please take this instruction very seriously. We want to keep you safe and healthy. Use common sense. If you are wondering if you should call, the answer is probably yes, you should call. I want to discuss unrelated donor contact with you. You may wish to contact or meet your donor. This is a personal decision. Many transplant recipients wish to do that and others do not. And several factors influence whether it is possible or not, such as the country where the donor lives. Countries have different rules about donor contact. Some allow for anonymous contact only, e.g. a dear donor letter without identifying information like your name or where you live. Some will allow you to identify yourself, and some do not allow any contact at all. In South Africa, there is a minimum waiting period of 3 years after transplant before the donor contact is permitted. In some countries, the minimum is 2 years. Anonymous correspondence managed through your registry may be permitted before a year has passed. Also, donor consent. If you want to contact your donor personally, they must consent to have their information released. And the same is true if your donor wants to contact you. Your consent must be obtained first. Anonymous correspondence does not require consent from either side. If you decide to proceed, the South African Bone Marrow Registry will facilitate this process for you. They will review what's allowed in your specific case, fill out the consent forms, and submit what you want sent to your donor. Anonymous letters and gifts will be carefully screened to ensure that no personally identifying information is contained, and your donor may or may not respond. Now, donor lymphocyte infusion, or DLI. If your leukemia or lymphoma comes back after transplant, you will likely need a DLI. Sometimes DLI is used to boost the donor graft when chimerism studies show low donor DNA in your blood. Lymphocytes are immune system cells that can attack leukemia. Think of a donor lymphocyte infusion as an immune system boost. Donor lymphocytes are collected and infused just like they were for your stem cell transplant. Whether your donor was your sibling or an unrelated person, they will be asked to donate again for you. Sometimes sibling donor lymphocytes are collected prior to the SCT and frozen for potential future use. Donor lymphocytes cannot be collected from umbilical cord blood though. There is no medication required to mobilize the lymphocytes. The cells are simply collected from a large vein in the arm. The blood is removed from the donor via a needle in one arm. The lymphocytes are siphoned off, and the rest of the blood is returned via a needle in the other arm. You will likely receive a round of chemotherapy called reinduction before your DLI. This will be similar to the very first round of chemotherapy you received right after you were diagnosed. The DLI may take place while you are still in the hospital recovering from your blood counts. The hope is that a war will begin between the lymphocytes and the cancer cells shortly after DLI. This happens if the lymphocytes see the cancer cells as foreign invaders, like bacteria, and attempt to destroy them. These phenomena are called, remember, graft versus leukemia, or GVL. The same lymphocytes are responsible for causing graft versus host disease, or GVHD. You may or may not have already experienced some level of GVHD during your recovery from your transplant. There is no lab test, unfortunately, which is capable of measuring graft versus leukemia. However, DLI will likely cause graft versus host disease. So if graft versus host disease is present, graft versus leukemia is potentially occurring because the immune system is showing signs of stimulation. Your graft versus host disease will be treated with steroids and other medications. And the hope is that the graft versus host disease will be mild and treatable, while the graft versus leukemia effect will result in remission of your disease. Your response to the DLI is measured by testing your blood and bone marrow and/or by repeating your PET and CT scans. Sometimes it takes several DLIs to achieve results. Graft versus host disease can limit the amount of DLI it is safe for you to receive. Unfortunately, DLI is not always effective in achieving or maintaining remission after stem cell transplant. And lastly, let's look at late effects and survivorship. Survivorship begins from the moment a potentially life-threatening disease diagnosis is made. There are several critical time points following stem cell transplant, such as plus 100 days, 6 months, and 1 year. But survivorship is more than a measurement of time passed. It encompasses every aspect of your physical, mental, emotional, and spiritual well-being. Recovery from SCT takes a long time. Many survivors are able to return to normal activities like work or school by the time they reach 1 year. However, almost everyone experiences some late effects or complications from the stem cell transplant. Late effects are side effects from chemotherapy that occur long after treatment is over. They may be temporary or permanent, and the impact on your life may range from mild to severe. The following list represents the most common late effects after stem cell transplant. The chronic GVHD, cataracts. Cataracts are a clouding of the lens of the eye and are common 3 to 4 years after transplant. Sexual dysfunction. Interest in sexual activity may take a long time to return after stem cell transplant. A variety of factors influence the feeling of in the mood, and sometimes body changes make sexual intercourse painful. Do not be embarrassed to bring up your questions or concerns. There may be treatments or recommendations that will help. Infertility. Most transplant patients are not fertile after allogeneic stem cell transplant. However, there are exceptions. The transplant center may have a fertility and reproductive medicine program which may address questions or concerns about fertility. Numbness and tingling, known as neuropathy. This is caused by nerve damage from chemotherapy. Nerves take a long time to heal. Generally, whatever numbness and tingling you have after a year has passed is likely to be permanent. Organ toxicities. Thyroid, lung, liver, and skin are the most common sites. However, medications used may injure any of the body's organs, causing late effects to appear. Secondary cancers. Exposure to chemotherapy and radiation increases your risk of developing other cancers later in life. These usually appear about 5 to 10 years after the initial exposure and can be difficult to treat. Adjusting to the new normal takes time, takes patience and continued effort from you and your caregiver team. Critical elements of survivorship are therefore the following: a continued routine surveillance of your disease status, graft versus host disease and engraftment studies, prevention and early detection of disease, including balanced diet and weight control, regular exercise, sun protection, routine checkups with your doctor, daily self-assessments, dental hygiene, control of chronic diseases such as diabetes, high blood pressure, etc., monitoring for the late effects, organ toxicities, and re-immunizations. So focus on quality of life matters. Return to work and school, your social life, your relationships, your sexuality, engaging in enjoyable activities. Have a look at your financial security and health insurance coverage and your spirituality. These books were compiled from trusted sources as well as utilizing expertise on the ground, with the sole aim to educate and empower patients and their caregivers before, during, and after the transplant, and make the journey less daunting. We all wish you a speedy recovery back to health.